The term subluxation can occur anywhere through the body. It can occur in the shoulder as a dislocation, it can occur in the knee as a knee dislocation, or it can occur along the spinal column. Virtually any joint in the body can become subluxated. Chiropractic is concerned with spinal subluxations, and when a spinal subluxation occurs, one or more of the segments becomes distorted, and it can be a minor distortion. I feel it's important for you to understand that this mild distortion does not cause pain. Rather, it causes a little bit of immobility through the joint. However, a subluxation will and always does cause some pressure to exert along the course of the nerve. And it is this pressure that we're concerned about. Because when there is a VSC, or a vertebral subluxation complex, the nerve's ability to be able to send vital information to some body part is blocked at this level, and that we feel is the beginning of a disease process. This is the normal relationship of two vertebrae. As you notice, there's a bone separated by a healthy disc, separated by bone, disc, bone, disc, bone, disc, and so on, 24 times down through the spinal column. Subluxations or misalignments occur when the vertebra starts to move out of position. And when it does, something very, very interesting occurs. We have here something called the spinal cord. The spinal cord can and frequently becomes irritated or blocked, as well as the nerve root, which comes out in between the vertebrae. So a subluxation can look something like this. Over time, although that is asymptomatic, over time that progresses and advances until there's significant blockage at the level of the nerve root. The next thing that occurs once a subluxation happens or occurs is there can be a nuclear bulge or hernia. And here you can see where the disc is now impinging on the nerve root, causing the nerve root to swell, as well as putting pressure on the spinal cord, thereby effectively blocking the brain's ability to communicate effectively with that part of the body. As this progresses over a period of time, frequently a patient will say, "I threw my back out," or "I threw my neck out." As the subluxation occurs, something forms called an osteophyte or a spur. This is an arthritic development where the body is now trying to grow the two segments together. The disc now thins out, and this is frequently when people seek relief of care from symptoms relating either to back pain or to problems where the nerve is blocked and the body is no longer receiving proper function. The final stage of this process is massive destruction of the disc, arthritic spurs causing these segments to join and fuse together, but the most devastating of all is the destruction to the nerve root, the overall compression and deterioration of the ability of this nerve to send signals which result in organ decay. At this stage, generally, there's not too much that can be done. It's usually a surgical correction, or a person is on medication for the rest of their life. I can't imagine what it would be like to have to take medication for the rest of your life, or for that matter, face reconstructive surgery. And that's the reason that I'm sharing the experience and the knowledge that I've been able to gain over the last 39 years through these videos. My name is Jeff Labelle. I'm a father, a husband, a doctor, and I want everyone to know the truth about health.